one of the things that I think goes really unnoticed and underappreciated is the physical causes of digestive issues. Hi, everyone. Welcome to Office Hours. My name is Jenny Askew. I'm the founder of the Nutrition Clinic for Digestive Health, and I am here with Erica and Rachel today. We are all dietitians and we all specialize in integrative and functional medicine. And today we are focusing on the physical causes of digestive problems. So, a lot of times, if you're having digestive problems, you might try a probiotic, you might be given a medication. You might try fiber, more fiber or less fiber. You might try drinking more water. There's all sorts of things that people try, but one of the things that I think goes really unnoticed and underappreciated is the physical causes of digestive issues. So today we're going to be focusing on that. And hopefully, if you're someone out there who's been struggling for a long time, you hear something that makes a lot of sense, and this kind of pushes you forward on your path of finally solving your digestive problems. Um, when we talk about the digestive system, there's lots of different organs, but it's all a single system. So it's really important that things are moving and functioning correctly. And we're kind of spinning this talk today off of a meeting we just had with someone from Southern Pelvic Health. So we're based out of Roswell, Georgia, or sorry, Woodstock, Georgia is more correct, which is right outside of Atlanta. And we work with a group of physical therapists that specialize in pelvic floor function and therapy. And it's really cool when you help someone realize that that could be an underlying cause of their digestive issues. So I'm going to let Rachel start today talking about a couple of like specialty topics that fall under the category of physical issues that can cause digestive problems. And then Erica's going to talk a little bit, and I'm going to kind of wrap everything up today. So, Rachel, go ahead and get us started on your favorite topics when it comes to physical health
Yeah.
digestive tract.
Yeah, there's a lot. I feel like anyone that has any sort of digestive disorder can always benefit from pelvic floor physical therapy. And one of the things that I really explain to my clients, it's very rare that it's just one problem. Usually it's a cascade of things that kind of create this perfect storm that can cause issues when people are coming to us for help. And this can be a really great topic to address and to help our clients optimize so that we can make sure that we are giving you the best support from every single angle. So I'm going to get started today and actually talk about motility and overgrowth and how we can encourage motility. So to kind of jump in, what is motility and why is it important? And this kind of comes in with both constipation and diarrhea. I think when you think of motility, you think, oh, it's just things moving along, having bowel movements, but it actually kind of ties into multiple things. So when we eat and food comes into our mouth and we chew, it has to make its way all through the GI tract. And it's not just gravity. Our intestines are kind of going up and down, and things are really nice and compact and a little twisted in there. And actually, the way that the food gets pushed down is through contractions, muscular contractions. And Erica will dive into the vagus nerve a little bit later, but it's through that nerve that things kind of get pushed down. And this mechanism, this wave that pushes everything down, is called the migrating motor complex, or the MMC. And it's a really key part of digestion. So anytime that migrating motor complex or that MMC is disrupted, the food might not be moving down the intestines at the right rate. And when it's sitting in the intestines for too long, that can be a problem because then all of the little strains of bacteria that we have in our intestinal tract, well, they're going to be overfed or can have an overgrowth of normal bacteria. So this is not an infection, right? But it can shift the balance of bacteria and then be causing issues downstream. It could be a small intestinal bacterial overgrowth, it could be methanogen overgrowth, it could be in the large intestine as well. So motility, so this can be a problem for constipation or diarrhea because if we're looking at a SIBO-specific case, right? If you're feeding the bacteria that are hydrogen producers, that could actually end up causing diarrhea and not necessarily constipation. But for a lot of people with constipation, they can have issues with contractions and moving things down. And there are many, many different things that can disrupt that. And one of the ones that I think is most interesting is if you think about the brain, right? And head injuries, those are things that can be disrupted. So if somebody has a history of concussions, or head injury or accidents, or a lot of times we think about athletes too, football players, or even if you played high school sports, right? This is something that could have happened and been a precursor to that because the brain is what's sending all those signals throughout the body. So that is really important. So what are a couple of things that you can do to encourage motility and to really support that? So waiting 4 hours in between meals, right? Because if you're constantly grazing all day, we're resetting the clock on that migrating complex and you're not really giving your body time for those waves to really push the food down. So super important. There are certain foods that are prokinetic agents. So ginger is one of our favorites. Ginger tea can be such a supportive thing to add. You'll notice that if you're on an herbal prokinetic, it'll usually have some ginger, artichoke, some of these other agents that naturally help with motility. Another one that comes up a lot too, stevia, right? Those artificial sweeteners can disrupt the MMC function as well as chewing gum, right? That also stimulates it as well. So those are a couple of tips that if motility is something that you struggle with, or you have one of those tricky SIBO cases that are relapsing a lot and you're on a prokinetic already, those are some things that you want to make sure that you're addressing. Um, Something else that I wanted to talk about was scar tissue and adhesions, because this is something that we ask a lot of questions around too. A lot of times, if we're working with a client and we've tried multiple things to help balance their gut, their microbiome's still off, and we don't even have to wait, honestly, to see if our protocols are working or not. Anytime we have a bacterial overgrowth case, you'll notice that we're going to start asking questions right away about what in your health history could have disrupted this mechanism from working efficiently and what is leading to the problem. So what are some things to keep in mind? Like who could have scar tissue or adhesion? So Crohn's and ulcerative colitis, IBD, can cause scar tissue, history of a hysterectomy, right? Or C-section, any of these reproductive surgeries. You know, with the C-section, you're making a cut through the abdominal wall. Hysterectomy, you're going in there, removing some of these organs. So when the body's trying to heal, it can have these adhesions. They're binding to different parts of the body and disrupting the flow. So something to keep in mind, appendicitis. There's actually research also coming out about having that appendix removed. It's probably through multiple mechanisms, but it can disrupt the overall balance of bacteria. So there, a lot of times they're like, oh, you don't need your appendix. It's a vestigial organ. Well, it can cause other issues. So something to keep in mind too. Any time of abdominal surgery, endometriosis, because we know that that tissue grows outside the uterus and that causes adhesions as well. Long-term SIBO, intestinal inflammation. So sometimes someone might be negative for all of these things. Well, let's go ahead and get you assessed and send you anyway, especially if none of our protocols are working or it's coming back and back and back and there's no clear reason why. Can be helpful to get pelvic floor therapy or visceral work, abdominal massage to help release these scar tissues and adhesions. Or anyone that has a major trauma to the abdomen, so think like a car wreck or maybe radiation therapy or something like that. So the what we would recommend in that instance is something called visceral work, which is a manual therapy technique that assesses that relationship between your body's organs and other structures. So this would be like muscles, fascia, ligaments, and joints. Wanted to show you guys a little something. Let me see if I can share my screen because this is going to make
Oh, here, I can.
perfect. Let me show you guys this little screenshot over here because I feel like this picture is perfect and really helps you guys visualize what I'm talking about. So anytime someone gets a surgery or things are healing, you see here how that scar tissue can form, and it's a natural mechanism, something normal that happens in the body, right? But when you eat, the food is coming down and look, it's disrupting the flow of things. And then that food is sitting in your intestines for too long, right? And then all the strains of bacteria that are going to be in that intestinal wall are going to be overgrowing, overfeeding, and we don't want that. So that's where something like pelvic floor, visceral work can be a really, really helpful complement to what we're doing to make sure that we're hitting this from multiple angles. So with adhesion specifically, there's a 90% chance with any sort of open abdominal surgery. So almost always, so for a good example would be like a C-section, they'll always recommend scar massage immediately after, even from things like if someone has breast reduction or something like that. The first thing to learn how to do anytime you have any sort of surgery is learning how to manipulate and massage any scars efficiently so that you're reducing all of the adhesions associated with it. And then there's also a 50 to 100% chance after pelvic surgery, so a little bit broader. And the reason for that is it can slow or stop the bacteria from leaving your intestines too, so that can be a problem. Strictures are a little bit different. It's a narrowing of the intestine. You can also have it with the esophagus too, and that can lead to blockage just because the diameter of that then starts to decrease and can be a problem that way. So those were the topics I had in mind to cover today. Hopefully that gives you guys some really good information of how to support motility and things for you to start thinking about in your own health history and your healing journey of what you can be doing. Maybe that is not directly diet or supplement related, but anatomy wise to support your goals while you're working with us.
Yeah,
So
I go ahead, Erica.
I was going to say, when people are probably like, I don't know, do I have this? Do I not have this? What would you recommend for them to do first? Should they see one of these specialists? Should they get a scan? What's kind of your thought on seeing if there's actually a physical issue?
I think a consult is super helpful because I know Jenny was saying we met with Southern Pelvic Health. I mean, their team seems to be super experienced at different levels of all of this. I know something I didn't really hit on that maybe if one of you guys want to talk about this is like the ileocecal valve too and how that kind of plays a role into everything too. So I think they are such a great starting point for you to like assess all of this. And I think like I don't think any sort of visceral massage would hurt. At least that's my instinct. So I think adding that as a compliment could help you get faster results, really. Yeah.
Yeah, and I think some of it, yeah, just like a simple consult and understanding if you're at risk for these things. And a lot of times you'll know because there will have been a preceding event, like a surgery or, something maybe traumatic, or if you have certain conditions, like you could be at risk. And I was just gonna say, like, I love this topic so much because it is so underappreciated. I don't think these things are being addressed or even asked about in conventional medicine. And it just makes me so happy that like this is what we do and this is why I love what we do because we're really helping people get the answers that they need to solve their digestive problems. And this is just such an underappreciated part of it, but so significant in terms of the impact that, things like scar tissue and adhesions and really looking at motility and appreciating that and thinking about that in terms of your digestive function. So awesome.
All right. Do you want me to jump in on mine?
Yes, I do. I can't wait to hear all about the vagus nerve today. So that's an
Okay. So
awesome.
this is another really
Yeah,
underappreciated area that,
love it.
oh, sorry. What were you saying?
I love it. I love talking about the vagus nerve because people don't know about this. And this could be so key to getting better. And the things that you do to strengthen the vagus nerve are so enjoyable. It's not like a terrible homework assignment to take better care of your vagus nerve.
I almost see it as it's like another muscle in the body, just like we exercise our body. I feel like we all could benefit from doing some vagus nerve stimulation. So, let me talk a little bit about what the vagus nerve is and what it does. It has a huge impact on gut health and, as Rachel said, on motility. And it's that bidirectional communication between the gut and the brain. So if you've heard of the gut brain axis, this is a key component of it. And it really does, it regulates a few different GI functions. So motility, as we mentioned, it can speed up or slow down how fast things are moving through our digestive tract. It also is involved in secretion of things like enzymes, of bile, of stomach acid. So if you're having digestive issues, this would be something to really consider. Sensitivity is another big one. So it modulates the sensitivity within the gut. So it can impact the perception of pain and discomfort. So we get a lot of our patients that come in and say, they're having this stomach pain or specifically more towards the colon. So this would be something to consider for if you're dealing with some of that. So if you're having slowed motility, it might be obvious, but let me just kind of cover this. You might experience things like constipation. You are definitely more at risk for SIBO, that small intestinal bacterial overgrowth, and gastroparesis. So if you're feeling like you're full right away after eating, if you're getting nauseous, those might be some signs of slowed motility. But then it also could be, on the flip side, increased motility. So if you're having diarrhea, if you've been diagnosed with IBS, those would be some situations there. So there are exercises that you can do that are really simple, and we suggest before eating to do some of these different things. So one would be gargling with water. So you literally would just put water in your mouth and gargle. And you could do humming or singing. So put on a song you like before you eat every time and try that. Gagging, I know this is probably not one of the most enjoyable ones, but that can stimulate that reflux in the vagus nerve. Cold exposure is another one. So you could put a cold rag on your neck or on your face. That can trigger a response. And that diaphragmic breathing. So, where the belly's going in and out, doing a couple deep breaths beforehand can be really helpful. And this is all connected to that sympathetic versus parasympathetic mode. So when we get in that relaxed state before we eat, it just improves the overall digestive capacity of the body. So I also like to talk about how this nerve can get damaged or dysfunctional. And actually, Jenny had just mentioned someone went through a surgery and they severed the vagus nerve, which I can't even imagine the impact of what something like that would be. So just something to consider if you've ever had a surgery, maybe there was some impact there. But I think one of the biggest offenders is chronic stress. And we all think we're, handling our stress just fine, but most of us have increased or prolonged stress, and that can affect the vagus nerve. Inflammation and immune dysregulation, those are really big ones. And a lot of our patients with GI issues have inflammation, have immune issues as well. Rachel mentioned this, but like brain injuries, that's a really big one. And that is something we screen for on our intake forms because we see such a connection with that. Things like metabolic disturbances can affect it as well. So if you have diabetes or metabolic syndrome or obesity, those things can disturb the vagus nerve. Even in my research, I was looking at some nutritional deficiencies. So certain nutrients can affect the vagus nerve. So B1, B12 can impact it. And those are often ones that are deficient when people have GI issues. Aging. So as we get older, just like everything else, it starts to degenerate a little bit. And then kind of like I mentioned before, the surgical interventions. So if you've had any type of surgery, stuff related to the stomach, definitely you want to work on those vagus nerve exercises. Anything I missed?
No, I was just gonna say I love this topic too. Outside of being a dietitian, I teach yoga a couple of times a week. And if you come to my class, you're not going to leave without me doing a quick 5-minute breathing exercise. And while you're breathing, so my favorite one to do with my students is just get them in child's pose and do some box breathing because I feel like that hold in between the inhale and exhale really helps activate your parasympathetic nervous system, your rest and digest. And as I'm doing it, I'm telling them if you take nothing out of this class, take these breathing exercises anytime you're feeling stressed at your desk, your kids are driving you crazy, you feel like the day is just never going to end. Take 5 minutes to do that. And it is just such an amazing tool to help you center yourself, recenter, calm your heart rate down, activate that parasympathetic nervous system, because that constant shift to that sympathetic, that fight or flight, it shuts everything off. It shuts off digestion. We see it affect hormones and things going on with your cycle if you're female, right? So many different things. So it is such truly an underappreciated part of our health and how our body functions.
I think some people maybe feel silly or they're like, is this actually doing anything?
Yeah.
Yeah. We've been trialing out this little product. I know you can't really see
Oh,
it very
yay.
well.
I'm so glad you brought
Yeah.
that today. I lent mine
Yeah.
to a client, so I don't have it right now.
Yeah, so it's called Truvaga, and it's this little electrode stimulator that you put literally right on the nerve here. And it gives you a little bit of a jolt, but you do it for like a minute or a minute and a half. It's through an app that you put on your phone. But it's FDA approved. It's for pain reduction, and they've been going through trials specifically with the vagus nerve. So for those that want to feel ensured that they're doing something, this could be a nice little tool for them too.
Yeah, and the app has like you can rate your stress levels every day when you do it. And are you supposed to do it twice a day? Is that what it is?
2 to 3 times a day.
Okay, so you can kind of track over time and see if your stress levels are decreasing with it. But yeah, that's pretty cool. Yeah, and I just think too, like, if, like your vagal nerve exercises are working because you will feel more relaxed in general. Like if your overall stress levels aren't decreasing, then I would say maybe the exercises aren't working or maybe it wasn't an issue, but I think you will just feel calmer and more in your body, less fight or flight response for sure.
But it is like an exercise. It's like exercising. You have to do
Yes.
it consistently. Just doing it one time and say, well, that didn't work isn't going to be good enough.
Yeah, it's like you said, it's like a muscle. Like you have to strengthen it over time. It's not like you can't do like 5 bicep curls and expect to be ripped the next day, right? It's the same thing with the vagus nerve. Cool. This is great. I love seeing you guys. I love the questions. I love the topic. I just love everything today. This has been awesome. So thanks so much for coming out and tuning in. And we will see you guys next month for more office hours.